Hello, Internet. Hello,
Oh,
Facebook. Hello, anywhere else this video may appear. My name is Samuel Huber from SamuelHuber.net. Huber Family Adventures on Instagram, Samuel Huber on YouTube, and Samuel Huber on Facebook. I'm here today with Angela. I'm sorry, can you pronounce your last name again?
Maciocia.
Maciocia. And we're going to learn a bit about her journey with autism. Angela, can you tell the folks a bit about yourself?
Sure. I'm from Canada. I'm from Montreal, Quebec. I have two sons. My youngest is on the spectrum. His name is Noah. He's 13. And I work as a special education teacher with adults on the spectrum and with other special needs as well.
That's really, really cool. So, before we get into autism, can you tell the folks what a master runner is? I'm curious. I've heard of runners before. What's a
So
master runner?
that just means I'm old. It just means I'm older. When you're like above 40, yeah, you get into that category. That's all it means. So master's runner, just 40 and up. Yeah.
Gotcha. All right.
Yeah.
Gotcha. I can't run at all, so that's an accomplishment.
That's okay. I've been running for a very long time, since I was 8 years old. So
What motivated you to be like just keep on running?
I just love it. It's one of probably the first loves of my life. I love it. I just love it. Yeah.
That's great. So moving on to your experience with your son, how has your perspective on autism changed over the years?
Oh my goodness. How has it changed over the years? Well, when my son first got diagnosed, he got diagnosed. He was 7 years old because he's quite, I don't know if you want to say higher on the spectrum or more autonomous or not as affected by autism as let's say people that are lower functioning. I hate that word, but that's the word that's still being used. So at first it was quite shocking to me, even though I've been in the field of special needs for now over 20 years. So it took me, but I always knew, I knew since he was about 18 months old. And it took me a very long time to get him diagnosed because I was told it wasn't apparent enough or he wasn't disabled enough. And I was told everything from I was a bad parent to he was spoiled to he had ODD, oppositional defiant disorder. He was being diagnosed with everything else except being on the spectrum. And I always knew he was. So once we got to kindergarten, we got kicked out. So he got kicked out of kindergarten. Yes, that happens. And then we ended up in a more specialized program, actually at one of the local hospitals here that runs a day program in their child psychiatry department. It has nothing to do with autism. And he stayed there for a year and a half. It was like a day program. And that's where he got diagnosed at 7 years old.
Thank you. I got diagnosed at 14, so your son has more.
Had 7 more, yeah. I mean, compared to like, I'm talking about, the early intervention, the children that, get diagnosed as young toddlers or babies or, yeah.
Gotcha. So how do you feel autism is treated in Canada? Because you're my first international interview, so.
Am I?
Yeah.
Wow, I'm so honored. Thank you. It's different in every province. I guess like in the US, it's different like in every state. So it's very different. I'm not sure about the way it's viewed, but the way it's supported is very different also in every province. So of course I'm going to say it's never enough, right? There's not enough support for programs, for respite programs, even for funding, So it's never going to be enough. I don't think I think we have a lot more work to do. But children are being more integrated, more included. So I see that happening, even with my students. But I think we still have a long way to go, and it's still a mystery to most people.
Right.
Yeah.
Yeah, and I definitely think that they try to all lump us into one category. But I like to say, a lot of professionals here in the U.S. like to say, you've met one person with autism, you met one person with autism.
One person, yeah. Or like I get a lot of, oh, he doesn't look autistic.
Oh, I hate that.
He doesn't look like,
Yeah, I get he doesn't talk like an autistic person.
Yeah, but people don't know. It's just, they just don't know. It's not their fault either. It's just, it's up to us to educate. That's what I try and do as I go along.
That's definitely a much higher perspective. What made you want to become a special ed teacher? And also, I saw on your Instagram that you're an ambassador. Can you go in a bit into both things, please?
Sure. I kind of fell into teaching. It's funny. I started off, like I said, I've always been in the field of mental health and special needs.
Mm,
So for many, many years, I worked in different centers where they had like work programs for people with all kinds of special needs, mainly Down syndrome, Fragile X, and autism level 3. Is it diagnosed? Well, yeah, in the DSMV, it's diagnosed level 1, 2, and 3. So you guys go by that as well, right?
I believe so, yes.
Yeah. So most of my students are level 3. Okay.
Mhm,
So they require a lot of support. So first, I worked in a center like that, like a readaptation center, where
mhm,
we just worked at like readaptation and rehabilitation, not rehabilitation, but finding them jobs, giving them a purpose, giving them a better quality of life. And
mhm,
then there was more and more, these adults were getting older,
mhm,
right? So once they finished their official, not official schooling, but their schooling from as a child till 21, they have to go into a workplace.
mhm,
So a lot in my area here, a lot of these school boards were opening up, let's say schools that were closed down, or um, uh, schools that weren't, like buildings that weren't in use anymore, and
mhm,
they were turning them into these adult centers for adults with disabilities, not necessarily with autism, but
mhm,
and they were looking for teachers. So what they were doing was that they had made a partnership with some readaptation centers in the area, so to mix in like continuing education and daily life skills and
mhm.
work skills. So, make long story short, they were looking for people. And although I didn't have a teaching degree per se, I had so much experience and they hired me. So that's how I got into it 7 years ago.
That's amazing. So what do
Yeah.
you so are you some kind of ambassador, and what exactly does that mean?
Oh, it just means that I represent a local running store.
Mhm,
So I'm supported and sponsored by 3 amazing sports clinics and a local running store. That's all. Yeah, that's what it means.
gotcha. Um, how important is self-care for parents with a child that's on the spectrum?
It's vital, vital. I think it's important for any parent, but for us special needs parents, it's really, really, because autism doesn't go away. It's not something. First of all, it's not something to be cured. But I mean, its challenges. It changes even now. When my son's going through puberty, I can see it's changing. Things are changing. So it's really, really important to keep your cup at least half full, or fill it
Mhm,
up when you can. Because I always say you can't pour from an empty cup. You really can't.
mhm,
So you really need to take time for yourself,
mhm.
take time out, ask for help, rest when you can. Yeah, it's very, very important.
Excellent. And that probably leads into your at least through Instagram, it appears you really love to work out. How has working out made you stronger, not just as a parent, but as a person?
Well, I think running in general is a metaphor for life. It's like you just keep taking one step in front of the other. And I find when you set goals for yourself,
Mhm,
that are apart from like your family and your kids, and only for yourself, it's empowering. You
mhm,
know, um, so that actually that helps me a lot as a
mhm,
special needs parent, because I have to have my own goals too in my own life. Apart from my children, and also in achieving those goals, you empower yourself. And yes, I use it. Yes, it's also good for stress relief and for your mental health also. But it's funny because it's my son that actually inspires me for my running.
mhm. How does he
Because
inspire you?
because he's overcome every obstacle set that's ever been set on him. And
Mhm,
even now at 13, he's resilient. He perseveres. He doesn't give up. He asks for help when he needs it. He's like a prime example of how a lot of us should be. So he's very, very inspiring to me.
Yeah, that definitely is really inspiring, and that's something that I do recognize not only myself through my experiences of being on the spectrum, but a lot of my clients and students are much more resilient than the average millennial.
Yep. Yeah.
Um, and I think that's a gift of autism, and that's why I try to teach parents. Is there's a positive way of looking at what your child has is going to teach.
Absolutely. Oh yeah. Oh no, there's a lot of gifts. Yeah.
Yeah, and also it teaches them to accept differences way easier than a lot of grown-ups do.
Yeah.
Like for example, I had a student who was a cross-dresser, and the kids asked him, "Why are you dressed like a woman?" And he's just like, "Because I feel like it." And they're like, "Oh, okay, no judgment," and they just went about their day. Like,
Yeah. Well, yeah. Yeah. That's awesome to hear though.
and that's why I just think that the way you're teaching your son is so powerful because it just you're teaching them to be a much stronger individual in this crazy world, and especially in this crazy.
Thank you. I've tried. I try. Yeah. I try my best. Well, I always, I make sure he knows that he's well supported and that he can get help, whether it's from me or a professional that I find or someone, a mentor. Like right now, he's actually being mentored by his mixed martial arts coach.
Mhm.
He's a wonderful young man, and he's also tutoring him in math. So I think once you find somebody that can really connect with your child, you go with that, you
Mhm.
know. So I think that's helped him quite a bit too. He's been working with, his name is Jacob. He's been working with Jacob now for almost 3 years. It's fantastic.
How's your son holding up with being stuck inside?
You know what? I was actually going to write a post about that soon. Just haven't had a chance. But out of the four of us, he's handling it the best. I think he's so used to handling like change and, um, just, well, change, change, but I mean like quick change, and adapting and having to adapt, that he's doing amazing. He's doing online school. Both my boys go to private school.
Mhm.
So they do online school all day. So they're busy. They have 5 more weeks of school.
That's amazing because autistic people are not known to accepting change. Like it's one of our.
I know, I purposely, I know it sounds bad, but in the past, even now I still do it sometimes. I purposely shift things really fast so that he has to get used to it.
Mm.
Yeah, I did that in the past. Yeah, a
Would you
lot.
recommend that for parents to do that?
Not unless you have how can I say? You have to have a plan in place. You can't just like do that because you're gonna have to, put up with maybe a meltdown or maybe some resistance or maybe some. So no, I don't recommend that to everybody. But because I think I'm in the field and I know what to expect from my son also. And I know what he can handle in the sense that, he's had so much intervention, so much social skills training,
Mm.
so much CBT, cognitive behavioral therapy. So he has a lot of coping mechanisms. So when I do that to him, it's kind of not like a test, but it's for him to practice his coping mechanisms. And he does great. Most of the time he does great.
Mhm.
Yeah.
Awesome. And I always like to end all my interviews with the following question: if you could change anything about how society sees autism, what would it be and why?
How people see autism? Sorry, I didn't get that.
Yeah, like yeah, as a society as a whole, like if you could change one thing, how the general public sees it.
Hmm. Well, I know it's a saying, but I mean that they're different, but they're not less.
Hmm.
And uh, an autistic person, depending on where they are on the spectrum, of course, can live a full life, just like anybody else. Have a job, have children, have. I mean, I know a lot of people that are on the spectrum that are professionals, that are married, that have. It doesn't, um, and that it's not, and also to break the stereotypes, it's not Rain Man, and like you said before, you meet one person on the spectrum, they're one person, there's so many, and also like, sorry, I can go on and on about this, the
Hmm.
differences between like the levels, I mean, we're talking about people that are more affected, it's autism and an intellectual disability, it's very different, you know
Right.
than being level one,
Hmm. Yeah. All right. Thank you for coming on the show. If people want to follow you or get more information on the tips that you use to help your son, how can they get in contact with you?
Oh, just through my Instagram, send me a direct message at Angela Maciocia. And I'm always glad to help. I reply to all my messages. I'm very open. Yeah.
All right, folks, follow her on Instagram. She's definitely an inspiration to parents out there. Angela, thank you so much for coming on
Thank
the
you.
show. This is Sam Huber signing off.
Bye.
Bye.